everybody. Actually, I am Dr. Jayanta Rana, practicing at Bardhaman, West Bengal, as a consultant medicine as well as diabetologist, preventive cardiologist, critical care specialist. So today's our topic of discussion regarding that is hypertension, because hypertension is one of the problem in worldwide, not only worldwide, as about the adult patient, it was about 25% of the patients suffering from the hypertension. But the scenario is not good because regarding the treatment of the patient. The first of all, the what's the effect of the hypertension? Hypertension is that it is a lateral pressure exerted to the your arterial wall by the hearts during pumping of the blood from the heart, and this is actually recorded at the hypertension, and we actually measured the hypertension by the sphygmomanometer, and previously it is mercury, now it is obsolete, but now we are mostly on the sphygmomanometer, that is with meter. Another is that is the electronic device, ambulatory blood pressure monitoring, or electronics device. Now the normal blood pressure, you all know that is it is 120 by 80, but different categories pressure have been depend if the patient is suffering from the renal disease or kidney disease, there is a below 130 by 80, or overall if you your blood pressure is greater than 140 by 90, then we call that is a blood pressure. But blood pressure is fluctuating day in the whole day because the diurnal variation, and mostly in the evening, that is 6 p.m. to 8:30 p.m. there is the evening surge of the blood pressure. That is the actually recognized by the ambulatory blood pressure monitoring. But what are the effect of the blood pressure? That is very important, because as a senior consultant physician, I have to look. That is the what are the effect of that? Effect of that. That is the what are the risk factor is there. First of all, that is the sedentary lifestyle. Second of all, diabetes. Third of all is that stress is one of the factors. Fourthly is the smoking as well as alcohol intake, and obviously lastly is the stress. And nowadays we are very much about the prepared food is there, and prepared food as well as the junk food we are taking from the Swiggy, Zomato, and the prepared food from the packet. These are the another reason, and salt intake. So these are the common factor actually increase your blood pressure. So if you going to the improve yourself regarding the and keep yourself regarding the hypertension, so you have to avoid this actually these products, and you have to quit smoking. First of all, you have to going for the regular exercise at least 150 minutes per week. And regarding the food, yes, there is some guideline is regarding the food. You have to take the food which are low salt. In the prepared product there is a high salt is there, and in your when you taking any food, uh, other time you have to take, if you take salt in extra salt if you want to take, because you 1 teaspoon salt is about 2,300 milligram. So it is better to avoid to take extra salt, and avoid smoking, regular exercise, take fruits, vegetables, low fat diet, as well as lenti. And the one of the most thing is that what is the available, that is in seasonal fruits, vegetables. That's very important, because our ancestor is usually use this, and as a result of that, there is a that time probably there is a disease is too much extent low. Now the diseases have been increased. Yes, probably the science also increased, but you have to take care of that. And now the primary health center, there is a blood pressure monitoring centers are there. There is a Asha Didi is there. There is a sub-center level, so you can check your blood pressure, because the blood pressure is the one thing you can check it in the primary level, and you have to check regularly after a certain age. And if you have a family history of hypertension, So after the age of the 30, you have to take care of your hypertension. And lastly, I just want to tell you one thing is that you have to take the medicine regularly. That is very important. When I give the patient in the one morning and one evening, and some patient is they monitor their blood pressure and is become normal, and come to us with this stop their evening blood pressure drug. So this is not should be done. Yes, after you measuring your blood pressure, then you have to if it is below, then you come to your physician, or if it is increased, you come to your physician. Sir, my blood pressure is not controlled. That is the good thing. Not stop the drug. You have to take the medicine regularly, because if you hypertension is the disease, it can cause so many disease. That is stroke, it cause cardiovascular disease, it can stroke in your eye, it may be blindness may be occurred. You can there is a other diseases also, that is a peripheral vascular disease, is because of this hypertension is also may occur. So these are the comorbidity have been happened due to hypertension. The most common thing is the cardiovascular disease, and lastly is the kidney disease, because uncontrolled hypertension, your kidney may damage. You have to make going to the dialysis. So these are the factor you have to keep in mind. So first of all, you have to check your blood pressure. You can check your blood pressure in the primary level. That is the only check the blood pressure. You can monitor it. Is thing that is the easiest way. You have to if anything, that is your sedentary lifestyle, take care of your food. You have to regular exercise, avoid smoking, and take your alcohol. If you take regular alcohol, you avoid that, and you are restricted that. And to avoid the stress, you are going to be going for the yoga is one of the good thing. And obviously in the that is the another thing to remove the stress. If you can't, you take consultant with your physician. That is another thing. And lastly, I just tell you this: you have to take the medicine very regularly, and in attach with your physician. So keep fit, and take the regular monitoring, regular exercise, as well as if you avoid the prepared food, and take vegetables, take fruits. And these are the this is my convey my words to all of you regarding the control your hypertension, and keep fit, as well as your life should be prolonged. And thank you very much. Keep well. সবাই ভালো থাকবেন. Thank you very much.